Well, welcome everyone. Really very happy you could join us today for this post-COVID-19 rebooting with research panel discussion on tackling real world problems. This is the fourth in a series, but the first of three that will focus on rebooting with research. This Rebooting with Research series looks more closely at cutting-edge U of W-based research that's making a difference and leading to the establishment of companies. So before we proceed further, the University of Waterloo would like to acknowledge that we live and work on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. The University of Waterloo is situated on the Haldeman Tract, and this is land promised to the Six Nations that includes 10 kilometers on each side of the Grand River. So welcome again. My name is Bridget Maloney. I'm the Managing Director of Jedi at the University of Waterloo. Jedi is the gateway for enterprises to discover innovation at Waterloo. So the University of Waterloo is very proud to host this webinar. As I said, it's the fourth in a six-part panel series. And as we all know and have experienced, COVID-19 has shaken the world and challenged societies and altered life as we know it. But from this crisis, opportunities have emerged, calling us to action as we prepare to reboot from this COVID-19 lockdown. So really how we work and behave and how society and the economy will function and how we innovate and educate will all change. So plotting the future for Canada, your enterprise, and yourself is complicated and challenging, as we all know. So our researchers and university partners are happy to share their research and perspectives. So a couple of housekeeping items. If you do have a question for our panel, please send it via the WebEx Q&A. Just click Q&A in the bottom right corner of your window and select all panelists before sending. This event is being recorded and it will be uploaded to the official U of Waterloo YouTube channel. So now I'd like to share a slide that shows all of our panelists and the moderator. So really excited you could join us today. And now I would like to introduce our moderator, Professor Roy Brower. Roy is the Executive Director of the Water Institute and Professor of Economics. So Roy, over to you.
Thank you very much for the introduction, and welcome everyone to this fourth panel on the post-COVID-19 reboot organized by Jedi. As Bridget said, my name is Roy Brouwer. I'm a professor in the Department of Economics at the University of Waterloo, and at the same time, I'm also the executive director of the Water Institute. This is the largest interdisciplinary water research and education center in Canada. We have more than 150 professors from all 6 faculties on campus and around 400 graduate students, and we're ranked among the top water research centers around the world. So this panel session, as Bridget said, is the first of 3 focusing on rebooting our research on campus and tackling real-world problems. And I'm very happy to have 3 other faculty professors with me here this afternoon. Professor Sue Orton from the Department of Economics, where I am as well, who's also a CG chair in Global Health Economics, and Professor Shannon Majewicz from the School of Public Health and Health Systems, and Professor Dan Scott from the Department of Geography and Environmental Management, and like me, the director of one of the research centers and institutes on University of Waterloo campus. We're also delighted to have the CEOs of 2 Waterloo startups here with us this afternoon, both of whom were successful in an aqua hacking competition that the Water Institute organized some years ago. Lawrence Smith from Polygon Technologies and Jason DeGlint from Blue Lion Labs. I will introduce each one of them to you more shortly. I wanted to start up by sharing my own perspective on how the pandemic affected the Water Institute. First, it has affected all of us working in a university environment, one way or the other. Those teaching courses now online, those relying for their research on fieldwork, lab experiments. And the university is gradually reopening, as you probably know. Those labs around campus, advised by a special working group, and foresees that they will be all open again by the end of July. We got to wait and see what the impact of the pandemic is on longer term research funding. In the short term, what we've seen is a reallocation of the research funding, obviously targeting the current pandemic. As an economist, I consider myself still very privileged to be able to work from home, and I foresee that this will be my new normal in the years to come. I do not have, or I do not need a lab like many of my colleagues in the Water Institute. Much of the data that I use or collected are available online. I'm working, for example, currently with a number of regions and cities across Canada to see what the trends are in household water consumption since the lockdown. So I received the data from these cities and regions through my email. But I have to admit that I miss the daily interactions with my colleagues from other disciplines or visitors in the Water Institute as well, of course, and the spontaneity of just passing by someone's office and brainstorm about new ideas. So going back a little bit in time, I had my last meeting in the office exactly 3 months ago. Be it a coincidence or not, it was Friday the 13th when I met with my strategic planning committee to celebrate the finalization of our new strategic plan for 2020-2025, but also at the same time to take the sad decision that we had to cancel our annual celebration of World Water Day 1 week later on Friday, March the 20th. For which we already had 150 people signed up, including a distinguished speaker, the Environmental Commissioner of Ontario, Diane Sachs. So in the Water Institute, we basically went through the following 3 stages since the lockdown 3 months ago. We had a first response stage right after the lockdown, which involved moving all our communications online, ensuring the continuity of our services and programming, and obviously the safety and mental well-being of our staff, and support the university in whatever way possible. And this includes, for example, the reallocation, like all the other all the other research centers and institutes did on campus as well. The seed grants reallocation to financially support graduate students working with Water Institute members who lost their co-op positions. And support Water Institute members working on COVID-related research, like Professor Mark Servos. He's a Canada Research Chair in Water Quality Protection, who works with local wastewater treatment facilities to develop methods to quantify virus fragments in wastewater influent as an early detection system of community infection. In the second stage, we reviewed and updated our brand new strategic plan to see how what we set out to do is influenced by the current pandemic, how we can prepare for a longer work from home situation and build resilience, especially to stay flexible and proactive. And examples of this during the second stage include meetings, virtual meetings with the Strategic Planning Committee to discuss the strengthening of our digital transformation of our future programming based on our strategic plan, more targeted communication as well, very important. We carefully timed resuming the publication of our digital bi-weekly newsletter, waiting also for what central services planned to bring out related to COVID, and pointing out very early on already to our members that we have a big archive of recorded water talks by renowned international water scholars that is publicly available on our website for faculty and students, which can be used for remote online classes. And then the third stage, where we are now, we implement what needs to be done to digitally transform the programming activities that I was referring to and develop an alternative online platform for the new academic year 2020-2021 to facilitate interdisciplinary research, education, knowledge mobilization, what is basically our core business. So basically all our programming for the fall and winter term are currently being planned virtual. We will have online water talks, knowledge mobilization, training of HQP, etc. Our biannual meeting in September this year of the International Advisory Board, which is chaired by Professor Joan Rose from Michigan State University, who's also the chair of the International Water Association's COVID-19 task force, will also be virtual. And we plan to have a half-day symposium with our board members on how COVID has affected the water sector. And maybe most importantly, and what we're going to talk about a lot today, is how we are working with our project funders, like the Queen Elizabeth Scholarship Program, in which we have around 35 international PhD students, postdocs, and early career scholars from around the world, working on Sustainable Development Goal number 6, which is access to clean and safe drinking water, and sanitation, to identify how our interdisciplinary research has been impacted by COVID, what modifications to the research program are needed to successfully complete these research programs, and what we set out to do initially, or how we can refocus our research on these new emerging questions related to the pandemic and the new normal. And the other panelists with us here today will also speak much more to this in a minute. So moving on from the Water Institute to another renowned interdisciplinary research center on campus, the Interdisciplinary Center for Climate Change, it's my pleasure to introduce to you the executive director of that institute, Professor Dan Scott, who is also professor in the Department of Geography and Environmental Management. And Dan's research focuses on global environmental change and sustainable tourism, a sector, as you know, heavily impacted by the current pandemic. And he published early on already a paper on how the pandemic affected the tourism sector, and that paper has been downloaded already more than 40,000 times so far. Our institutes, the Water Institute and the Climate Center, work together a lot. The teams are highly interlinked, and we develop joint activities. Most recently, just before the lockdown, in the museum downtown Kitchener, where we organized a public event about water and climate action. So it's my pleasure to welcome Dan. We're happy to have you here with us. And one question I would like to ask you is that some commentators have drawn parallels between this pandemic and climate change. How do you see that COVID-19 will influence responses to the climate crisis?
Thanks for that, Roy. Yeah, it's a big question, a multi-trillion-dollar question, and the pandemic really is a double-edged sword for climate change. You know, it seems, at least to me anyway, it seems like years ago when we had millions of people marching in the streets for climate action, you know, when really it was only 6 months ago, we had real social momentum on the climate file, the likes that I haven't seen in the more than 20 years that I've been doing climate change related work. Now that, you know, and rightfully so, the society had to be focused on the immediate risks of the pandemic and now longstanding, you know, systematic racism. And so these are all big challenges we have to deal with. But the climate crisis hasn't gone away either. Initially, there was a lot of coverage in the media about, you know, improved air quality in China and Italy. You could see the mountains, the parts of the Himalayas that you hadn't seen in decades. But I would say to the audience, you know, largely ignore those. Those are temporary reductions. We'll take them. It was sort of best estimates I've seen are greenhouse gas emissions will be down 4 to 6% this year, and that's great. It's a temporary blip, but that's not how we need to achieve you know, progress on the climate file. We need systematic change in our energy systems and some of the other agriculture, deforestation, and other things. Not lockdown. So just by way of context, in May alone, we hit 417 parts per million CO2 in the atmosphere, and that's the highest level that we've recorded, but it's also the highest level in 3 million years. And we've also had the warmest May on record, in 2020 is projected to be the warmest year. So climate change isn't going away, and if anything, what we're likely to see this year, unfortunately, are what we might call compound events, where some of the climate related disasters, be they hurricanes in the Caribbean, wildfires in Canada, drought, floods, you name it, are going to be superimposed on communities that are struggling with safely responding to COVID, and often it's going to be the most vulnerable that pay the price, unfortunately. So, like in the water sector, some negative implications of the pandemic. Our international negotiations every year, for the UN has a major climate conference where a lot of decisions are made. The last minute negotiations go into those. That's been postponed for a full year. So we're not going to see those decisions made until late in 2021, which is unfortunate. We're also seeing sort of emboldened nationalism, certainly south of our border, but Brazil and some other places. And that's really antithetical to the type of multilateral governance we need to take on a global challenge like climate change. So that's a longer term trend that's been in the works, but I think, you know, the COVID seems to have accentuated that a little bit. On the business side, what we're seeing is, you know, businesses are distracted. Many are in survival mode. So major changes in the way they do things, from operations to policy, major investments, those are being postponed. And even more broadly, the low price of oil reduces some of the business case to take real action in the near term. So those are some of the things that may work against us. Where the positive comes, or where the balance will be is really what is the nature of the stimulus packages to come. The first ones are focused on employment, getting people back to work, covering them while they're off work. But it's those post pandemic stimulus packages that are really going to make the difference. And we've seen some really good dialogues in the EU and a little bit here in Canada. Here we have a self-created task force for resilient recovery. Myself and some other people who sit on the Institute for Climate Choices here in Canada are adding our voices into that. So hopefully government listens to that, because what we've really got is a once in a generation sort of decision, a once in a generation massive investment. And if it doesn't push us in the direction or support our transition to a low carbon economy, the cupboard's going to be bare for a decade. And so we'll be set back probably 10 years. And unfortunately in the States, what we're seeing is that there's really no integration of a new Green Deal or anything of that nature in the States. Europe, Canada is showing some positive nature. China, as well as part of their recovery, is showing some good signs. So we're positive on that, but it's really going to depend on how some of those decisions are made. And the last point that I just would raise is some people have raised parallels between the pandemic or the response to the pandemic and climate change, and whether the pandemic has given us a sort of foretaste of the climate crisis to come. And I would agree that there are certainly some lessons to be learned on the dangers of ignoring scientific community or ignoring warnings. When you read the warnings and scenarios, the sort of wargaming that were done on pandemics from 15, even 20 years ago, it's really frustrating to see that and how unprepared we were. We're watching the same thing sort of play out in slow motion on climate change. For 25 years that I've been doing this, we've been, trying to get government to take action more seriously and more expeditiously. We had a proposal called 3 years ago called Canada in a Climate Disrupted World. You could take out the word climate and throw in COVID. And COVID's, revealed to us the impacts on supply chains, border security, and geopolitics that come with it, the rapid change in investment markets, competitiveness, vulnerable populations. All of that has been exposed to us, and that's what we anticipate climate change will bring in different ways. So we hope this pandemic actually moves us forward in terms of listening to the scientific community and being better prepared.
Thank you very much, Dan, for that extensive answer. We'll come back to you and talk a little bit more with you about the tourism sector, more specifically your area of expertise. I propose we move to Lauren Smith, who is the co-founder of Polygon Technologies, an all-female clean tech startup and a PhD candidate in the School of Environment, Resources and Sustainability. Welcome also to you, Lauren. We're very happy to have you on board. And a question I would like to ask you is, as a CEO of an all-female clean tech startup, how has COVID affected your business, and how do you foresee a post-COVID reboot change your existing business model?
Yeah, thanks, Roy, and thanks, Dan, for your comments as well. I'll give you a little bit of context for what my company does before addressing how COVID affected us. So we started out in an aqua hacking competition, trying to address the problem of microplastics, so tiny plastics that are in our waterways and also getting into our food and beverage. So initially we tried to stop the plastics from entering our waterways, so trying to develop a filter, but realized we still had a lot of problems with detecting microplastics at all. It's still a very new problem, so there's a lot of work to be done there. So we switched focus to develop a method to just detect the plastics quickly and in a more cost-effective way, which is great. So just before the pandemic kind of hit our region full force and lockdown happened, we had just gotten our international patents filed, which was super great. But now that campus is closed, we don't have access to our lab since we work out of an on-campus lab. So that's kind of stopped that in its tracks a bit. We had some pilots ongoing with some local breweries, which are on hold for now. They're trying to just keep their doors open and adapt themselves to the changes. So during this time, we're lucky enough that in our home office, we have a 3D printer. I run the business with my partner. So we have been able to 3D print some face shields and PPE just to donate to some of the local efforts and direct to some community frontline workers and also people that were just needed extra safety. So just trying to be able to convert our efforts to do both PhD candidates as well. So we're working on our PhDs at the same time. So that's what we're doing now. Post-COVID, it's a little bit unclear. Not really sure when we get access back to our lab. So we'll kind of just take it as it comes is our plan. But we know that kind of we'll definitely be doing something in some way to make the world a better place, whether we try and put products out there for people with the 3D printer or stick to the microplastics route. We'll kind of see what happens as we sort of get back to work on that end. But I know we're definitely to be trying to make the world a better place either way.
Thank you very much. Lauren, like Dan, I propose we go for a second round. We'll ask you some more questions, especially also related to your work as a PhD student in the University of Waterloo. I'd like to introduce Professor Sue Orton to you. We're very happy to have her here participate as well. She's my colleague, as I mentioned, in the economics department, but she's also cross-appointed in applied health sciences, and she's the CG chair in global health economics. So we could not have had a more relevant panelist here, perhaps also with you here today, Sue. Welcome, and thank you for joining us. The question I would like to ask you, first of all, is we've seen an incredible increase in testing, public health testing, and focus on the impact of health testing. How do you see this as having a lasting effect on health priorities in Canada and perhaps maybe elsewhere as well?
Yeah, thanks, Roy, for that question. So before the COVID pandemic started, I was working with some colleagues on the Lancet Commission on Diagnostics. So this is a group of about 25 people from 16 countries all across the world. And we'll publish our report probably about a year from now in the Lancet, which is a very high profile place. And the reason we got into this particular project was that we're all interested in health, we're all interested in global health, and we felt that as part of universal health coverage, there had been too little emphasis on diagnostics and testing. So diagnostics includes lab tests, point of care tests, which you keep seeing every day of the week in the news about COVID, and then also medical imaging. So diagnostic testing is a big problem for marginalized populations and also for low and low middle income countries because they have very poor access. So, people who don't have health insurance don't have access often to free testing. I guess the pandemic has changed that in that everyone gets access in the rich countries to free testing, even if they don't get normally that kind of access. But in low and low middle income countries, typically less than 10% of the population has access even to really basic tests like, blood glucose, which you need for diabetes, or even blood pressure, because the health facilities that are within walking distance of their homes, we use 2 hours as a definition of feasible walking distance. Even if they are supposed to have the tests available, they're not there. The governments don't fund them. So, for example, the World Health Organization recommends that all pregnant women should get a panel of 8 different tests, plus once during the pregnancy, they should get an ultrasound. But the work we're doing in the Commission suggests that in poor countries, women don't have access to any of these tests at their local health centers. And even if they go to the district hospital, which may be a long, long distance away, the test may not be available the day they go. And here it's common, everyone gets ultrasound during pregnancy, but that's the exception rather than the rule in low and middle income countries. Okay. And so why do people not get diagnostic tests? Partly it's because the government doesn't fund it. And then also individuals themselves, if they have low incomes and the choice is, do you want to test yourself for something or do you want to pay for the treatment? Of course, they're going to choose treatment, even if they're not really sure that they have malaria or whatever. So the outcome is that health outcomes are worse, that there's economic waste because people are treated for conditions they don't have, which may be actually dangerous to their health. because the doctors use things like presumptive diagnosis or syndromic testing. And these are bad both for health and for the economic outcomes. And one key outcome that we worry about is antimicrobial resistance. If the doctors hand out antibacterials antibiotics to people without testing whether or not they really have a bacterial infection, it worsens the outcome. It makes the antibiotics less effective. When COVID came along, suddenly the issue that we were working on became headlines. Tedros at the WHO started talking about testing, in the same way that real estate agents talk about location. And I'm sure you've all read about, in the US, part of their terrible start to responding to the pandemic was that the test that the CDC put out wasn't a good test, and it slowed down their ability to test. On the other hand, you get interesting new developments, such as in Africa, with assistance from British DFID. They've developed a $1 test for COVID, which they're going to produce in Senegal. So you can see some possible solutions coming around. And just for running the commission, it's made life quite complicated. I mean, on the one hand, our commissioners are on the front lines and we'll be able to, incorporate this into our report. So John Nkengasong is the director of Africa CDC, which has become a political football between the US and China, and is also trying to backstop testing all the way through the continent. We had two former health ministers, Patty Garcia from Peru and Bernice Dawn from Liberia. Bernice Dawn had gone through the Ebola epidemic in Liberia, and Patty Garcia is on the front lines trying to help, in her current role as a university professor with the policies for COVID in Peru, which is facing a terrible epidemic at the moment. And one of our US colleagues, Alain Brique, is at Johns Hopkins, and we can never get him on the phone because they first had to develop the guidelines for the state and then for the city, they're now working on the plans. So I guess it's interesting that our timing wasn't intentional, but hopefully it will bring more attention to this issue. But the other thing I'm concerned about is that we hope this issue will not be forgotten once the COVID epidemic is tamed. So thanks.
Thank you very much, Sue. Yes, and it's very clear that the impacts of the pandemic in different parts of the world are very different. As I mentioned, we're working with Queen Elizabeth Scholarship students and focusing also on water and sanitation in developing countries and the impacts of the pandemic on access to clean drinking water, like you're talking about access to testing. It's very unequally distributed, as we also observe from working with scholars in these different places. Thank you very much. We'll come back to you in a minute. We would like to also explore a little bit more the link with the Sustainable Development Goals later on. I'd like to introduce now first also Professor Shannon Majewicz. She is a professor in the School of Public Health and Health Systems, and she's specialized in infectious diseases. Welcome also to you, Shannon. You're actually an infectious disease epidemiologist, and you study how people get sick from the food they eat and what we can do to prevent such illnesses. Can you tell us a little bit more about how COVID has affected your research?
Yeah, no, thanks, Roy. Maybe before I get into the sort of specific details about my own research program, I want to pick up on a point that I've heard from the other panelists about the impacts that we've seen historically about the difficulties we have getting individuals and governments and organizations to invest, and whether that's time or resources, in doing the things that need to be done to prevent or get prepared for threats that we can't really perceive with our senses. So it's very easy, and I found this as someone who has worked in public health for 10 years before joining academia. and now as a public health academic, being able to make the argument for why we should spend time and money to be prepared for things like pandemics and climate change is a very difficult sell. And so I hope that one of the things that comes out of the pandemic is an appreciation for the need to be prepared for the things that aren't kind of immediately threatening us. So fires and earthquakes and that sort of often preparedness is a bit of an easier sell, I think. Invisible microbes is a bit of a tougher sell, and I found that certainly myself with my research and funding historically. Back to your question specifically, it's actually been quite interesting to see how this pandemic highlights things that I think that most of us know at some level, which is our health outcomes are all very intimately connected. And whether that's through biological processes or the fact that they're influenced in different ways by the types of things we do to intervene and try and improve health, it really highlighted for me, again, how much these sort of grand world events can influence our health in a whole variety of ways, both sort of good and not so good. And so you've seen in the headlines a discussion and a rightful focus on the impacts of things like lockdown, particularly in our long-term care homes, on the mental health and well-being of individuals. So we have some health outcomes across the spectrum that are impacted and driven by the things we do to prevent infectious diseases. With respect to my particular area of research, which, as you mentioned, is foodborne disease, it's interesting, we see some synergies. So the hand washing campaigns that are happening around the world, we actually anticipate will have a positive impact on reducing foodborne diseases. In part because when people go to prepare food, hopefully their hand hygiene is better. And so we see some synergies. We see some sort of antagonism happening as well. And so that as we have conditions like lockdowns where people are really eating and cooking much more in their homes, perhaps than they usually do, and attempting, their sourdough breads and that sort of thing, it shifts the location where these foodborne diseases happen. We know that one of the main places where these diseases come about are in people's own homes. So we really like to blame the restaurants for when we get sick from food, but it's very often our own cooking. And so we have all of these kind of different trends and niches that are emerging in new ways. And through the ongoing data collection that we're doing, we really have to account for that. And so now we're thinking about how do we measure the impacts of these public health interventions on the rates of foodborne disease, for example. And it's quite, from an epidemiology standpoint, a fascinating natural experiment, and we can look and see how some of these things might change.
Yeah. Thank you very much, Shannon. And from talking to you earlier before this webinar, there are some similarities between the kind of work that we're both doing. You're also looking a lot to behavioral change. So the pandemic is about developing a vaccine and making sure that people are safe, but it is highly dependent on how people behave. Could you also speak very briefly to this topic, perhaps?
Yeah, absolutely. So I think just to reiterate what we're seeing and a lot of what we need to do, and whether, I'd be interested to hear from Dan, but whether it's, to deal with a novel infectious disease or, change how we adapt in the face of climate change, we need to really do things and behave in different ways. And that could be on an individual level, like hand washing, et cetera. The one thing I do want to say is that we know that simply asking people to do things differently and giving them the reasons why they should is really our very least effective way to change behavior. So there's lots of evidence from public health that simply asking people to do something and telling them why to do it is not a particularly useful mechanism, that we really do need to work systemically to either, or sorry, not either, but I would say all of these in concert to change the environment and shape the bigger environment so we get the behaviors that we want, to change social norms, right? To make things like wearing masks a positively viewed behavior as opposed to a negatively viewed behavior. And to really build kind of deep habits and support people to make those habits the easy choice.
Okay, thank you. Thank you very much. We'll get back to you in a second round as well. I'm going to move on to the last panelist, Jason de Flint. He's a co-founder of 2 startups and winner of the 2017 Aqua Hacking competition based on his Blue Line Lab concept of applying AI and machine learning to detect toxic cyanobacteria in the Great Lakes. Welcome, Jason, to the panel. Very happy to have you here. You're currently so thanks for joining us, Jason. So you're currently involved in 2 different startups, each coming out of your research, a medtech company called Hedgehog Medical and a clean tech company, the Blue Lion Labs, with which you also won the Aqua Hacking competition. Can you briefly explain what each of these startups does, and how has the pandemic changed, for example, your operations in the Blue Lion Labs?
Yeah, that's a great question. Yeah, so my background is in engineering and computer vision. And so both startups actually came out of my passion for computer vision and using AI to improve people's lives around the globe. So I'm currently working full-time at Blue Lion at my postdoc here at the University of Waterloo. However, Hedgehog started before Blue Lion, so I'll just briefly talk about Hedgehog. So in my master's research in 2015, I had the chance to work with the research lab in kinesiology led by Dr. Richard Hewson. And they were doing research to measure arteries from ultrasound data to determine cardiovascular health. And so essentially what they needed to do is, like, as the heart's pumping, your arteries are pulsating, and they needed a computer vision algorithm to automatically measure that diameter over time. So my one colleague in the lab and myself developed this computer vision algorithm for this kinesiology lab. And after we developed it for them, we asked ourselves, well, is there any potential to sell this elsewhere? And in the summer of 2016, we actually sold it to a number of universities around North America. And since then, Hedgehog Medical has been running on autopilot. It's just kind of been doing its own thing. Recently, due to the pandemic, there's been a huge shift in Hedgehog Medical, and we can dive into that later. I'll just stick to your question, Roy. Blue Lion actually started with my PhD. So after Hedgehog, I started my PhD. And my PhD was looking at computer vision and AI to automatically analyze algae and microorganisms in water. And these algae can produce toxins, which can be very harmful to human health, as well as there's many other environmental factors. And what happens right now is if you're, for example, a drinking water treatment plant, and you have an algae bloom, you have to take a sample and ship it away, and you have to wait for a human to analyze that sample. So what my research was essentially looking at is, like, how can we start to automate that process? So essentially we're replacing the human eye with a camera, and we're replacing the task of identifying these different organisms with a machine learning algorithm. And so throughout my PhD, we explored potential business opportunities. As you mentioned, Roy, we participated in the 2017 Aqua Hacking competition. I just finished my PhD in last December, and I brought on a co-founder named Katie Thomas, and we've been working on Blue Lion since. And so we were super excited in January, just like, I'm done my PhD, we can focus on the business aspect. And we were making a lot of progress. We were talking to municipalities, setting up pilot studies, and then COVID came in like a giant wave. The one municipality we were talking to, it's quite a significant water utility here in Ontario. They had to back out of a pilot that we were setting up with them because they started channeling all their budget to COVID-related projects. So it's definitely started to impact us. It's also just on a day-to-day basis, I think one of the most noticeable things is both Katie and I are working from home, where I saw her almost every single day. We could brainstorm and collaborate and talk. Now I know she's at her house, I'm at my house, and we have to be intentional. Otherwise, in the beginning, the whole week could pass and we're like, wow, we hardly even talked, right? So just the intentionality behind it became very, very important. But the flip side of that at the same time is the world is kind of getting extremely smaller. We're now having video calls with people all around the world, whereas before we'd probably email people, maybe get a response, maybe get a call would be a good outcome. But now it's common to just say, hey, do you have time to jump on a video chat? And we're talking with people in Norway and the Netherlands, where there's kind of like these water-centric communities dealing with algae. So we're very grateful for that. So it's kind of like a win and a loss at the same time.
Thank you very much. I'd be very interested, I'll come back to you in the second round to hear a little bit more from both you and Lauren, what your thoughts would be on what you would need to continue with the concepts that you developed in your startup. So maybe something to think about. I'll get back to you and Lauren about that in a minute. I would like to start the second round of questions. So Dan, if I may come back to you, let's go back maybe to some of your own personal research interests, and that's the tourism industry, which has been very hard hit by the pandemic. Almost 100% of the fleet is on the ground. Traveling is maybe starting up a little bit more at the moment. Based on the research that you've published, how do you see the reboot unfolding in that particular sector, and what are some of the longer term changes and opportunities perhaps that come with the current pandemic?
Thanks, Roy. Yeah, travel is something I think everybody on this webinar can relate to, either whether it's your business or holidays. We've probably all had some travel plans, particularly as academics in that spring, sort of early summer. That's conference season for many of us. That's all been disrupted. You mentioned some of the events that you had that had to be canceled. I was in the Caribbean when the world went sideways, and I worked there regularly over the last sort of decade and a half, and it was sad to watch their tourism economies go into free fall. And when I got back, I immediately, as Jason said, I worked with colleagues in around the world, and I immediately got in touch with colleagues in New Zealand and Sweden, what their experience, what was happening there. And we put together a rapid assessment paper that you mentioned earlier, that now within 6 weeks, maybe 7 weeks now, has over 40,000 downloads. So there's a huge demand for insight in the sector, in part because the impact has been unprecedented and devastating. 95% of the world was under travel restrictions. As you mentioned, tens of thousands of planes parked, cruise ships being referred to as floating petri dishes. So we've seen already in the sector over 100 million jobs lost around the world, and in the UN World Tourism Organization expects, at least in terms of international arrivals, the sector is going to be set back 7 years. And I'll say a little bit more at the end what that could mean for the Caribbean. But globally, that's sort of roughly, they're estimating about 10 times the impact of the economic crisis about a decade ago. We are seeing the reboot start. As we all know, China, the Asia Pacific tourism region, in terms of the pandemic, is a couple months ahead of us, and so too are they on the reboot. And there's some really important lessons for us. Some communities or destination communities in Japan, for example, they opened, and then as their cases spiked by imported cases coming from other cities, they had to shut it back down. We saw the same, an Indonesian airline called Lion. They operated for about a week, and then they stopped. They said, the travelers were not following the rules, the guidelines, and they were putting their staff at risk. So they just shut it back down after about a week. Europe's next. We're seeing discussions of bilateral travel bubbles that you don't have to do the 14-day quarantine. Sicily's paying sort of half the price of air and hotel for 10,000 people. And they're marking out these grids on the beaches. The Vatican's back open. So things are coming. What that's going to do in terms of cases, we'll have to follow that. But here in Canada, really, with the US border being closed, and it's going to stay closed for a while, and international travel very restricted still, it's going to be a domestic recovery. And that's good because it can help reduce our international travel deficit. But even here, we're seeing resentment. So some, you may have seen in the news, cars with Alberta plates in interior BC were being vandalized and nasty notes put on them. People in cottage country are a bit apprehensive, shall we say, of visitors from the GTA coming. So there's a real role for the federal and provincial government to help support this sort of reboot of the tourism sector domestically, both safely, but it's key so that some of the small, medium enterprises that dominate the sector are going to be there to survive. Now, to your point, what's the long term look like? That is truly the sort of multi-trillion-dollar question. There's been tons of speculation, as there are in other sectors. Most of it we can ignore because nobody has a crystal ball on this, other than the one certainty is the sector is going to get changed forever. And that's again, two ways. I would just remind everybody that coming out of the last economic recession, that's where Airbnb came from. They emerged for the part of the shared economy. So there's going to be opportunities, some of which will stick with the sector for quite some time and make it better. But we know some of the major pieces like air travel is going to change the same way it did after 9/11, and security changed. Now it's going to be from a health perspective. As part of our analysis, we mapped where the international airports are relative to the pandemic hotspots, where the next one would come from. And there's over 100 international airports within or right on the edges of those pandemic hotspots. So those will have to be sentinels for surveillance. But as Sue mentioned, our diagnostics for that are shall we say, poor. When Toronto screened for over 1 million passengers for SARS in 2003, a bit of 2004, they caught 0 cases. So that was a huge investment of time that was largely for optics. It made you feel good that people were testing, but nothing was actually being caught. So for Sue and her colleagues, I hope they can come up with much better systems, because as of about 10 days ago, Emirates, the way they were testing before a flight was they were doing blood work. How many people want to sign up for that in airports around the world? So that will change. We know certain business models will be broken by COVID. Low-cost air carriers, their business models get as many people into that aircraft as possible and turn it around as quickly as possible. With deep cleaning, with physical distancing, that doesn't work. That the same can be said for some cruise or all-inclusive buffets. Hopefully Shannon has some suggestions to make those safer. If she does, there's a big opportunity ahead for that. But we might see some parts of the business actually come back, like travel agents. It's their job to know, where can you go? What will you expect when you get there? What are the health protocols? What is my travel insurance covered? People now can't sort all that out. And so hopefully that might actually bring back some of that business.
Thank you, Dan.
Oh, wait. Can I just say one last thing, Roy? Just to Shannon's point and yours on behavior change, I completely agree that that's a massive challenge for all of us. And just next week, there's an international panel, I just looked it up, international panel on behavior change. So Imre Seisman and Angela Carter from UW are two that are part of it. It's not just a climate change one, but it's to focus on everything to do with the sustainable development goals in other areas. So it's all about what tools, what types of research can help foster the kind of behavior change that we're all talking about.
Thank you. Thank you very much, Dan. Thank you also for the reference. I'd like to quickly move on to Lauren. Lauren, you're also a PhD student or candidate in the School of Environment, Resource and Sustainability, and you work on water innovation and gender. Can you tell us a little bit more about how COVID has made solving water problems a challenge, and what role do you foresee for clean tech after COVID?
Sure. So I'll start with how COVID is making solving water problems a bit more challenging. To respond to that, I'll speak a bit of my research. So I work with gender equity and water innovation, which involves how humans respond to life-threatening messages. So we think about living these days, hearing about COVID, we're always looking at and hearing about the mortality rates in other countries and in our own country, what we can do to keep ourselves safe, what number of cases are going on. So we're always getting these reminders that, we are going to die someday, but we don't really like thinking about that. So we have certain psychological defenses that can help us deal with that existential dread of knowing that someday we are going to die. So I have a background in psychology, but now I'm tying it to environment and gender equity. So in addition to these defenses we have to avoid thinking about our mortality, we also know that diverse groups make better groups that have 50% or more women make more environmentally focused. So that is probably going to help us make strong and sustainable water solutions. So maybe that means we can get more women in government. Maybe that'll solve some of those ultrasound access problems that Sue was talking about. So unfortunately, though, these defenses that we have to avoid the existential dread from mortality, involves us to, it makes us connect greater ties with our own culture. So that can be great. We can connect more with our communities, things that we identify with, we cling strongly to those, because even if our bodies die, our culture can live on. So we can live forever through our culture. So that's one common defense. But unfortunately, what that means is that we tend to prefer people that are most like us and distance ourselves from people that aren't like us. So that means that, so there's some studies that show after thinking about our mortality, white people are more lenient to white racists. Americans will rate American positive narratives more highly than those that are critical of American culture or that are written by non-Americans. And we also have seen that these mortality types. Speaking of who's making decisions on how to create water solutions, it's a largely male-dominated field. And so if we're trying to increase diversity in this field, messaging about COVID that are mortality reminders, it might be particularly challenging to do that. It was already difficult in pre-COVID times to try and increase gender diversity because of all these stereotypes and societal expectations in these spaces, but it might be even more challenging considering these defenses and unconscious biases that are kind of being strengthened with these mortality reminders. So to think of how clean tech can help post-COVID, certainly that wastewater sampling, as you mentioned, Mark Service's work is going anywhere, so we're definitely going to need clean tech to help. Maybe there's some plastic use increasing, thinking of all of the extra PPE that we're needing to use in everyday life these days. And I think what's clean tech is going to have to keep in mind to create solutions is that this, again, is another male-dominated field. And if we're going to try and create really strong solutions that'll work for everybody and address the needs of everybody in recovery post-COVID, we're going to have to be really intentional, but making sure these decisions and leaders include diverse group members that are included and they get the funding that they need to implement those solutions as well. And if we don't do that, there's a risk that's going to be a very narrow set of solutions and they may not be as effective as they really could be.
Okay, thank you very much, Lauren. I propose we quickly move on and give the time to Sue. Sue, would you be able to very briefly elaborate a little bit more about how you see the effects of COVID-19 on the achievement of the SDGs, especially then in relation to your own field of research, namely public health?
Yeah, that's a tall order to do in 1 minute. That would be the breadth of the Sustainable Development Goals. But I'm really interested also to hear some audience questions. So like Dan, I think it's a glass half full, glass half empty. You know, on the one hand, we can see how much more important universal health coverage or, you know, climate action is, given now the confluence with the pandemic. But on the other hand, it's not making it any easier to achieve these goals. I mean, I'll just list things really quickly. The cost of the pandemic is going to affect the funds that were available for the SDGs, which were already a very ambitious targets. I mean, I've seen one estimate that it requires 7% of world GDP each year to meet those goals. I mean, that's no way that's going to happen in the near future. We see the WHO being defunded in the middle of the pandemic, and we see all kinds of dog-eat-dog solutions where people are talking about, you know, I want the IP for this vaccine, I'm paying for it, and I am going to have first access to it. So, you know, that's not going to help. We see in the low and middle income countries, people are scared to go to the doctors. So their kids are not getting measles immunization and they're not being tested for TB. And in the high income countries, we see that people who have heart attacks are unwilling to go to the hospital, they're afraid, or people not going if they have suspected cancer and they can't get treated. It also has impacts on education. And I and some colleagues are doing work in South Asia on the long-term impacts on girls dropping out of school, getting married early, having children early as a potential outcome of this pandemic. Anyway, I'll leave it here. Thanks.
Thank you very much, Sue. Maybe one minute, Jason, if I can turn to you, the question about what do you need for your startups, and maybe Lauren, later on in the Q&A session, you can chip in on that as well. Very briefly, in 1 minute, Jason, could you expand a little bit about that?
Yeah, I'd love to. I'll go as fast as I can. One thing that Dan said really resonated with me of as terrible as this pandemic has been, there will be opportunities. And I think one thing I've noticed with the Hedgehog medical team is like the company was kind of on autopilot. We're all doing our own things. And we had 2 PhDs in computer vision, 2 masters in business, a full stack software engineer. And we asked ourselves, what can we do, right? Like, is there anything we can do? Clearly we have built already an ultrasound tool. And so what we said is like, okay, let's just see what, right? And so we talked to doctors around the world, read papers, interviewed doctors, collected data. And like, we're saying like, given as tragic as everything is, what can we do? So I think what we need at Hedgehog Medical is well, funds. Both Blue Line and Hedgehog need capital in the sense that we're on tight budgets. We've been applying to every opportunity possible. Unfortunately, that's very selective. And so I think more capital, which is probably a hard ask. The other thing is data and more collaborations. I think this post-COVID world, and I truly believe the world has changed forever now, is going to need to be more collaborative. So definitely open to collaborations.
Thank you very much. I'm afraid that we will have to leave it here. Hopefully we'll have some opportunities to talk a bit more to some of these topics that passed by in the Q&A session. So I want to thank you all once again, all the panelists, for participating this afternoon, for your time. Dan, Sue, Shannon, Lauren, and Jason, thank you very much for sharing your experiences with us this afternoon. And I would like to hand over with this to Bridget again.
Thank you very much, Roy. And I'd like to give a very big thank you to the audience as well for joining us, and encourage you to stay for the Q&A, which begins momentarily. Just a reminder to submit a question. Click the small Q&A in the bottom right corner of your screen and select all panelists before sending the question. A very big thank you to Roy, as I said, and also to all the panelists. So Lauren, or Sue, Shannon, Dan, Jason, and Lauren, you know, your insights and expertise and comments were extremely valuable and very topical at this time. So with that, if you have any further questions or perhaps heard something today that intrigued you, I encourage you to reach out to me, Bridget Maloney. You can find my email on the Jedi homepage where you registered for this event. And for those not familiar with Jedi, it is the gateway for enterprises to discover innovation at the University of Waterloo. I'd also like to add in the thank you follow-up email that everyone will receive following this webinar today. We also included some links to additional COVID-related research that the University of Waterloo researchers are working on, so you might find that interesting. And a very brief 2-minute survey, hoping folks can have time to complete and tell us what you'd like to learn more about and what you enjoyed. So now I would like to share just a slide on the upcoming panels. Our next panel is next Thursday, June 18th, and the topic again is rebooting with research. It's viral detection and mitigation. And please go to uwaterloo.ca/Jedi/events for more information and registration, as well as videos of the previous webinars. So with that, we look forward to seeing you then, and please stay now for the Q&A. So I'd like to thank the audience for submitting questions in advance, and I've been provided with a selection of questions to put to the panel. All the panelists, including the moderator, Roy, are all welcome to contribute to the discussion of the questions. And we'll try and keep the answers somewhat short to allow a maximum number of questions. So I have the first question, and this one is for Shannon. The first question goes to you and does come to us via the online webinar registration system. And maybe Jason, you could also comment, given what the companies you're attached to do. So the question is, how do you see remote research with healthcare workers looking? What is it going to look like in the near future?
Thanks, Bridget. Yeah, I had a few points, a few thoughts. Just again, briefly picking up on already. One opportunity is that geography becomes a lot less of a barrier under these remote working conditions. So I think that we have an opportunity to expand the types of people we reach out to and want to engage with. And if you find, you're not getting traction with attempting to start research with healthcare workers in your local area, there's nothing restricting you from going further afield, which I think is actually a very interesting opportunity. I do think in some ways the most important thing is unchanged, which is these kinds of sort of remote research projects are founded on the need for strong partnerships. And sometimes the time it takes to build those relationships can't be rushed, particularly in a crisis. And that the healthcare workers right now are really stretched thin and having a hard time even articulating how remote research might be able to help. So really, spending the time to help healthcare workers or others on the front lines articulate and understand what their needs are and how the types of research that we do can help. I think the onus is much more on the researcher now than the healthcare worker to do that.
Thank you. Thank you very much, Shannon. Jason, do you have anything you'd like to add?
I can add a few points, and I can only really speak to what I know, coming from a background in computer vision, and so with Hedgehog Medical having a strong computer science and business focus, and then approaching the lung ultrasound space, a lot of what Shannon is saying of a lot of collaborations, and we reached out to hospitals and doctors. They graciously gave us time and helped us understand what their problems were. And we're essentially working very, very closely with hospitals in North America. We continue to look for more opportunities, but essentially these doctors are sending us data, and we're fully dependent on them and working with them. I think that's a great synergy going on. I think a future challenge is really going to be what happens when we have to test this tool. And like when Hedgehog Medical built their first tool for artery tracking, we would go to the users, watch them use the software, talk with them. In this post-COVID world, I don't know how that's going to look like in the sense of a number of business people, entrepreneurs, software developers coming to an ER hospital. I don't know, is that even going to be allowed, right? And that's pretty critical in order to get feedback and to improve the tool. So it's an unknown. I have no doubt that as we're all in this together, we're going to figure it out together as well. And then humans never cease to be amazing and be creative, right? So yeah, I'm not sure, but we'll figure it out.
Thank you. Thanks, Jason. So next question, Dan, this one goes to you. How has U of W contributed to the solution of COVID-19, or at least to our understanding of the effects it's having, and how might we mitigate these effects? It's a multi-part question, so
yeah, that's a big one, and actually you can probably answer it better than I can. I won't pretend to know the full extent of all the awesome work that's going on campus, but I would say, I think that's the intention of all 6 of these webinars, is to showcase some of the great work that's going on and how diverse it actually is. Today we're talking health, water, climate, tourism, and a few other things. Next week, I think, is about viral detection, is probably more specific to that question of how are we actually helping to detect and manage COVID as a pandemic itself, as opposed to the socioeconomic outcomes that come out the back end. But I think that's a great question. I think it's an awesome project for Alumni Magazine to fill a few issues over the next couple of years on all the great work that's been going on. So I'll leave it at that.
Well, thank you, and you might have something to say in the Waterloo magazine. That the next half of the question was, given your leadership role with the Interdisciplinary Center on Climate Change, what parallels are you seeing to the climate change crisis. And so I'll either leave you to comment on that, or it might be a nice piece for you.
I'll be very brief because I talked a little bit about it, and Roy was probably chasing me off earlier for going overtime. So, but the one point that others have brought up that I did want to emphasize is that the reboot is not going to be equitable, whether it's for health outcomes, whether it's for tourism, whether it's for climate. We're doing some work for the World Bank right now on the climate piece, or on the COVID connection with climate in the Caribbean, and that's one of the most dominant themes. It's usually the most vulnerable either regions or populations that are going to pay the heaviest price, unfortunately.
Right. Thank you. So for the next question, Roy, I'll direct the question to you. In your opinion, what is the best way to take research, say from your Water Institute, and apply it or implement it in the real world? The person who posed this question mentions they work in the private sector and enjoy the relationships they have with researchers on various topics. So how should they best structure that research so they get tangible and usable outcomes? And maybe Susan, then you could add some remarks based on your experiences in the Center for Bioengineering and Biotechnology.
I can start off. That's a very good question, and it's something that that we're working on very explicitly in the Water Institute. Water is a very complex good. We've learned a lot from previous water crises. I don't want to compare them with the current pandemic, but typically these kind of crises require a very strong collaboration with the people who manage, for example, a natural resource like water in this particular case. So important terms are co-creation, for example, co-creation of knowledge, identifying what exactly the relevant questions are that policymakers, the industry wants to see answered, and to which we then for which we then develop our research program. So from the start, having a close collaboration and understanding of what is driving the problem, what is the extent of the problem, how is the problem affecting different groups in society. So the distributional or equity concerns that have come up several times also during this webinar, these are all crucial aspects of designing collaborative research, and that is what we train our students to do in, for example, the collaborative water program that we have in the Water Institute, where graduate students from engineering learn about water governance, economics, etc. And this is the nice thing, the genuinely curiosity-driven research that goes on at the University of Waterloo is that we are fantastically able to come up with innovative technical solutions. We got the science, we got the engineering there, but crucially important in all these discussions is what Shannon was touching on is you need people to actually adopt those technologies. You have early adopters, then it has to be rolled out over larger groups of people. So behavioral change in combination with the science and engineering that goes on in Waterloo makes often these kind of complex issues more manageable. Having multiple perspectives on these complex issues helps to come up with innovative solutions, and that is based on co-creation.
Thank you. Sue, is there anything you'd like to add?
Just to echo a couple of things that Roy's already mentioned. Obviously, you have to engage in your team with people with real world experience. I mean, the government is trying to provide particular forms of grants that encourage us to do that. You know, grants on knowledge translation, and then these current New Frontiers in Research translation grants. So you can't develop your fancy ideas in your ivory tower and then go and expect that people out in the real world will be wanting to adopt them. You have to have them involved from the beginning. And as Roy mentioned, University of Waterloo is a somewhat unique university. Let me also mention the co-op aspect, you know, because so many of our students, you know, work in the real world and combine that with their academic experience. I think that makes us more nimble in this area.
Thank you. And actually following on from this topic, this question, given your ongoing research into microplastics and now taking those efforts and establishing a company based on that research in an effort to get such a tangible and usable outcome, that should give you a really valuable perspective on the question. So what are your thoughts there?
Really echoing again what's been said, that if we can make all these great tech solutions, but if we're not talking to the people that are going to use them or considering what sort of solution they need to use, and it's not really going to be useful in the end. So whether you're trying to solve a microplastics problem or a COVID related problem or climate change, you really need to be considering the people that are going to use that solution. And we've touched on behavior change a few times, and I think that's really part of it as well, is considering also, well, in your conversations with people and what sort of solution they need and are going to use, talking to them and figuring out the best messaging to change that behavior. There's lots of research in the public health sector that can also be applied with climate change and probably also with COVID. How is the best way to communicate to somebody to wear a mask somewhere? Some people respond really well with just the information, maybe of it's for your own safety or for the safety of others. But other people will need a different type of framing to be able to actually change that behavior. So it kind of all ties all these pieces together, I think, making sure we include the consideration from the social sciences and the natural sciences. They tend to be too separated, but bring that to the real world, or they really have to work together to make effective solutions.
Right. Thank you very much. Dan, a question came in from the audience while you were speaking related to the correlation between greenhouse gas emissions and global temperatures. Would you be able to clarify your question specifically related to why we are seeing temperatures rise while emissions are dropping?
Emissions are not dropping, other than very briefly, we're having a couple month drop. 2019, we had the highest emissions we've had. Some countries are stabilizing, but as a globe, they are continuing. So the 4 to 6%, the best, most robust estimates I've seen are for this year. That's largely, but not entirely, related to changing in transport. We're not flying. Most of us are not driving. So you're seeing CO2 emissions drop, but also NOx. So that's why you're getting the better air quality in big cities. So that's a temporary change. The climate system responds on much bigger time frame. So that those emissions, that concentration of CO2 is already in the atmosphere, and that's what the system is responding to. So we'll get this temporary blip down, but some fear, again, like we saw with the economic recession, once that blip goes down, the recovery comes roaring back and you actually get a rebound effect, and your emissions are actually higher than when you went into it, unfortunately. We'll see if that happens.
Thank you. Thank you for explaining that and clarifying that. So Shannon, a question for you. An audience member who had been working in industry has been working on mask production and innovative pharmaceutical and vaccines production. Do you have any suggestions as to where to go and find people and institutions that might be interested?
Yeah, thanks. So specific to COVID, what's come out of, one of the good things that's come out of this is there are these creations of these portals, these web portals that are collations of researchers, of people who have different resources. And so, of course, I don't have the website off the top of my head, but there is a pan-Canadian COVID research portal. I think that, again, really thinking about building kind of that interdisciplinary team, not sure who else is at the table for this particular individual, but thinking across the board of what your needs are in terms of moving these things closer to market, considering things around regulation, et cetera. But if it's in terms of connecting with with researchers. Clearly, Waterloo through Jedi can make some connections that way. But broader than just this institution, there is that larger COVID research portal.
Super. Thank you very much. So this one over to Jason. This one is for you. So you spoke about using computer vision for detecting algae in drinking water. With the recent news of wastewater being a potential predictor for COVID, do you see any synergies with the technology you've developed?
That's a fantastic question. I remember reading those headlines and looking into it. As I understand it, they're doing PCR testing, just like the standard COVID test. And our technology is optical based. It's not a chemical based technology. So in that situation, there might be some collaboration, but there's not a direct relationship between what we can measure and what they're looking to measure. I think where an opportunity might lie is using some type of data analysis or machine learning to work with that data. But in order to know that, I would need to further and in depth talk to the people, understand the problem, and understand what the data is and what they're measuring and what they need to predict. So it's a pretty vague answer. I think there is an opportunity there. I've heard of it, but I haven't had time to dig deep on that, unfortunately. So,
no, that's great. Thank you. So, Dan, another question for you came in. Do you think there are any adjustments made for COVID-19? Example, work from home, the trend in growing vegetables in home gardens, in-country travel versus international, that can be easily sustained or encouraged post-COVID-19? And are those changes significant enough to be meaningful?
That's an awesome question. I think for all of us, we're looking at which of these changes might stick that contribute to sustainability writ large. So many of us are professors and professionals that can work from home sometimes, maybe a lot of times. But more people were thrust into that environment where they have to, and they've got some experience. So I think some of that definitely will stick. And certainly on the business travel side of things, there are a lot of co-benefits beyond. There's cost reduction, there's productivity increase, there's health benefits, there's family benefits of not having to travel as much. So the more we can do from this, there's a lot of co-benefits for society that hopefully some of those will stick. Are those enough to take on climate change? It'll help. But what we really need to change is energy systems. We have to get coal out of the equation, period, as a starting point. We have to get eventually off of fossil fuels. So we need to be net zero by sort of mid-century. And us staying at home isn't going to do that. It will help. And as well, some of the local food, bringing food closer to home definitely helps as well as going vegetarian if you can.
Thank you. Great. So an audience member is asking, they're saying, I would be interested to hear from the panelists what they think the world should focus on in relation with water security, particularly in the mega cities in the post-COVID pandemic. So Lauren, maybe we can start with you and then move on to other panelists who are also looking at water.
Sure, I can try. That's a huge question. I'm not an expert in water security by any means, but I can offer what I think would be good to focus on. In the mega cities, well, I guess, so part of our problem with water is, and part of the security problem is, having enough and having enough when we need it. So thinking of mega cities, trying to be more efficient with our water use. So one of the ways in cities to do part of that hasn't gone quite as far, had as much uptake, would be some water reuse strategies. So whether that's reusing our wastewater, and that can tie into some of the other conversations. And it's also maybe a bit tricky to move forward because people don't really like the optics or the appeal of reusing our wastewater as drinking water for some other source, right? But we can do that. There's some energy issues as well, but maybe that's one area to focus on, trying to improve our water reuse strategies and making sure we have more water when we need it and use less of it. So lots of things all tied up in that, but maybe that's a rough place to start.
Right. Thank you, Lauren. Who else would like to comment? Roy.
I can say a few things. So the experiences are very different around the world. I think that is a very important point to make. So I can speak a little bit about what happens here in Canada and in Europe, fairly developed countries, and probably the US as well. So what is remarkable is how resilient our water supply system has been. I mean, we're all working from home. We all have safe access to safe drinking water. Our wastewater is being treated as before. We've seen peaks, especially in Europe, in the increase of water consumption, domestic household water consumption. We haven't seen that as clearly here in Canada, but that is a lot related also to the fact that Europe has had a severe drought already for a couple of months. It maybe starts increasing here in Canada as well, now that it gets warmer, although people are moving out of their homes now with the reopening as well. But it's been remarkably resilient in the Western world. In developing countries, it's a completely different story, perhaps, where there was already very unequal access to safe drinking waters. A lot of these megacities around the world are found in developing countries. Mexico City, we've done some research in Dhaka in Bangladesh, the capital city of Bangladesh. Lots of progress has been made in these mega cities in aligning the energy, the water, waste infrastructure with the growing population. I don't have the data to speak to how COVID has deteriorated perhaps access to safe drinking water. What is very obvious is that the basic needs were never equally distributed across the globe. So I don't think that it will definitely not have improved. More, it will have deteriorated, and that's something that we have to monitor in the coming time. How that will progress. But here. There are some great opportunities. Lauren already talked to it a little bit. There are measures that we can take to increase the water use efficiency, especially also in Canada, where per capita consumption is relatively high compared to the rest of the world. I think we're second largest water consumer in the world after the US. So there are lots of technological innovations ready available on the market that we can introduce and will help maybe also to improve the water security in our own cities.
Thank you, Roy. Would anyone else like to comment? We have only one final question came in, so before we move to that, welcome any other comments. Okay, why don't we move to the very last question? We just have a couple of minutes for that. So sorry, Sue, it's for you. And I don't mean to put a time limit on you. Again, apologies for that. But this final question I'd like to direct to you, Sue. So the discussion about research being done with actual researchers is very helpful. But more generally, how can those who are not as connected with research environments remain informed of so much of the thought leadership and expertise coming from research, especially as this pandemic seems to have shortened the distance between what is happening on a daily basis and the areas of research happening at universities?
Question. So as a consumer of research that's not exactly in my own area, I have to say that I now start the day by looking at world news now. I quite often read The Guardian, maybe that's because I was born in the UK, but you often find really interesting links in that to existing research. I also have to say I was a complete naive about tweeting until the start of the pandemic. And then I was told, you've got to send tweets out from your Lancet Commission. So that also made me follow things. For example, we get a very North American Eurocentric view of the press. But Al Jazeera, for example, has all kinds of really interesting stories about other parts of the world. And some of them are just about current events, but also clearly there are links to what's going on in research. So, keep an open mind and explore many sources. I think that's what I would say.
Fantastic. Thanks very much, Sue. Any last comments before we close up for today?
Dan here. I'd really like to echo what Sue said. I haven't been such a big consumer of my Apple News feed and other things because it's really shortened the connections between those of us in the ivory tower doing our research, those who are doing startups, and the decision makers. It's accelerated the need for innovation, but compressed the timelines in all the areas that we work with. And so we're all sort of learning on the fly from all these other areas. And somebody who's trying to develop a class on how climate or how pandemics change the world, there's just so much out there beyond the topics that we've had that's so hard to keep up with. So we're all in the same boat. Whoever issued that question, we're all challenged the same way for sure.
Thanks, Dan. And so I'd like to close things off by thanking the audience today for your participation and your attendance, and a very big thank you to Roy as moderator, and also to Lauren, Jason, Dan, Sue, and Shannon for answering all the questions and having a really interesting and informative discussion. It was really enlightening and very topical and important matters. So thank you very much. So for the audience, if you have any further questions, or perhaps you heard something today that intrigued you to explore further, again, I invite you to reach out to me, Bridget Maloney, Managing Director of Jedi at the University of Waterloo. You can find my email on the Jedi homepage where you registered for this event. So I'll just share the upcoming final webinars. The next panel webinar is next Thursday, June 18th. The topic is rebooting with research. And it's specifically a topic of viral detection and mitigation. So please go to uwaterloo/Jedi/events to register and for more information. And we look forward to seeing you then. And this closes the session for today. Very big thank you to everyone for joining us and for participating. And I wish you goodbye. Thank you.